In this video, let us learn about the blood supply of the brainstem. Brain is supplied by two sets of arteries, an anterior carotid system of blood vessels and a posterior vertebrobasilar system of blood vessels. Carotid system includes the internal carotid arteries and their branches, and the posterior vertebrobasilar system include the two vertebral arteries joining together to form the basilar artery and their immediate branches. The carotid system will supply predominantly the structures derived from the forebrain vesicle, that is, most of the cerebral hemispheres and the diencephalon. Whereas the posterior vertebrobasilar system will supply all the structures derived from the hindbrain and midbrain vesicles, also some of the structures derived from the forebrain vesicles. Put in other words, this posterior vertebrobasilar system supplies the entire brainstem, cerebellum, and some parts of the cerebrum as well as diencephalon. Vertebral arteries arise from the first part of the subclavian artery in the lower neck. These arteries ascend through the neck and reach the cranial cavity. So for description purpose, the course of the artery is divided into four parts. The first part is from the point of its origin till it reaches the foramen transversarium of C6 vertebra. Second part is as it ascends through the foramina transversaria of upper 6 cervical vertebrae. Third part is that portion which is seen in the suboccipital triangle, where the artery will be coursing over the arch of atlas. And fourth part, or the terminal part, is the portion which is seen within the cranial cavity. So here we are seeing the fourth parts of the vertebral artery of right and left side, where they course around the medulla, and at the pontomedullary junction, the right and left arteries join together to form the single basilar artery. Now this basilar artery ascends along the midline in front of the pons, where it will be related to the basilar sulcus, and at the upper end of the pons, this basilar artery terminates by dividing into terminal branches. First, let us look into the branches given by the vertebral artery. The major named branches given by the vertebral artery include the right and left anterior spinal arteries, which soon join together to form a single midline anterior spinal artery, which will be descending along the anterior median fissure to supply the anterior part of the spinal cord. The other arteries arising from vertebral artery include the posterior inferior cerebellar arteries, which will be supplying the posterior aspect of inferior surface of cerebellum. Posterior spinal arteries are often branches of these posterior inferior cerebellar arteries, otherwise known as pica, but often they can arise also as a direct branch of vertebral artery. Now coming to the branches given by the basilar artery, the first pair of arteries are the anterior inferior cerebellar arteries, which again, as their name suggests, will be supplying the anterior aspect of inferior surface of the cerebellum. The basilar artery then goes on to give multiple lateral branches known as pontine branches. There is a branch known as labyrinthine artery, which is often a branch of anterior inferior cerebellar artery, but it can be given as a direct branch from basilar artery. This labyrinthine artery supplies the internal ear as well as 7th and 8th cranial nerves after they exit from the brainstem. Finally, at the upper border of the pons, the basilar artery terminates by dividing into two pairs of arteries, a proximal pair of superior cerebellar arteries and a distal final terminal branches known as posterior cerebral arteries. The superior cerebellar artery is separated by the posterior cerebral artery by a sheet of dura mater known as tentorium cerebelli. Now coming to the blood supply of brainstem, medulla, which is the lowermost part of the brainstem, is supplied predominantly by the branches of vertebral artery. Pons, which is the middle part of the brainstem, is supplied predominantly by the branches of basilar artery. And midbrain, which is the uppermost part, is supplied predominantly by the branches of posterior cerebral artery. If you take a section of brainstem at any level, each half of the brainstem section will be supplied by three sets of branches. a paramedian branches which will be supplying the median zone of the brainstem. Then we have short and long circumferential branches which will be supplying the anterolateral zone and the posterolateral zone. There is very little anastomosis between the branches given on the right side and the left side. So if there is lesion involving any one side, the structures which will be affected will be belonging to the same side and therefore result in a very characteristic symptom complex. Now coming to the blood supply of medulla. The paramedian branches which will be supplying the median zone will be arising from the anterior spinal artery. As you recollect, this is the branch of vertebral artery. The anterolateral and the posterolateral zones will be supplied by branches given by the posterior inferior cerebellar artery, again a branch of the vertebral artery. Uppermost part of the medulla, however, may receive few direct branches given by the basilar artery. Now coming to list the structures which are supplied by these paramedian branches and the circumferential branches. On either side of the midline, from before backwards, we have pyramids, medial lemnisci and hypoglossal nucleus with its nerve. So the paramedian branches given by the anterior spinal artery will be supplying these structures. So if anterior spinal artery is involved or it is blocked due to any reason, then the pyramids, medial lemnisci and hypoglossal nucleus and nerve will be affected, resulting in a symptom complex known as medial medullary syndrome. Similarly, in the anterolateral and posterolateral area, we have olives, group of fiber bundles like inferior cerebellar peduncle, spinal lemniscus and dorsal longitudinal fasciculus, including the descending autonomic fibers, and some of the cranial nerve nuclei like spinal nucleus of trigeminal, nucleus ambiguus and vestibular nuclei. So the posterior inferior cerebellar artery through its anterior, the short circumferential and the long circumferential branches will be supplying all these structures listed here which are located in the lateral aspect. So if the posterior inferior cerebellar artery is blocked for any reason, then all these structures will be affected on the same side, resulting in a symptom complex known as lateral medullary syndrome. Both medial medullary and lateral medullary syndromes will be studied in a separate video. Now coming to the blood supply of the pons. On the left side we are seeing the section of the pons at the lower level, and on the right side we are seeing section of the pons at the upper level. Pons is supplied by branches of the basilar artery which will be traveling along the midline in the basilar sulcus. The basilar artery gives the paramedian branches, which are branches arising from the pontine arteries, which will be supplying the medial parts of the basilar pons as well as medial part of the tegmentum, which includes medial longitudinal fasciculus and abducens nucleus. The basilar artery will also give short circumferential branches, which can be direct branches or branches arising from the pontine arteries. At the lower level, the long circumferential branches arising from the basilar artery will be also supplemented by the branches given by the anterior inferior cerebellar artery. Now these two sets will be supplying the posterolateral part of the pons, either through their basal branches or through the dorsolateral branches. Similarly, in the upper level, the long circumferential branches will be supplemented by the branches coming from the superior cerebellar artery, which will be again supplying through the basal branches or the dorsolateral branches. Coming to the blood supply of midbrain, the basilar artery will give direct branches known as paramedian branches, which will be supplying only the medial parts of the cerebral peduncles, nucleus of the oculomotor nerve as well as the red nucleus, whereas the entire rest of the midbrain is supplied by the branches of posterior cerebral arteries. It will give either the basal branches, which will be supplying the cerebral peduncles, or it will be giving the dorsolateral branches, which will be supplying the lateral part of the tegmentum, including spinal and trigeminal lemnisci. Subsequently, it goes further posteriorly to supply the tectal region. So, few things to summarize. Firstly, the entire brainstem is supplied by the posterior vertebrobasilar system. Medulla is supplied by the branches of vertebral artery predominantly. Pons is supplied by the branches of basilar artery, and the midbrain is supplied predominantly by the branches of posterior cerebral artery. Each half of the brainstem section receives blood supply through 3 sets of vessels, paramedian branches which will be supplying the medial zone, and we have anterolateral area supplied by short circumferential vessels and posterolateral area supplied by the long circumferential vessels. Depending upon which artery is involved, the structures of the same side will be affected, resulting in a particular combination of symptom complex, resulting in we have actually a set of brainstem syndromes depending upon at what level the brainstem is affected. That we will go on to study in our next video. Thank you very much. Thank you for your patient listening. You can visit this site for other neuroanatomy videos. Thank you.